This video is on anatomical position and how we refer to the position of the human body as we study different anatomical structures, because their location is key in the way that you stand when you're talking about a muscle will depend on what the muscle looks like. So anatomical position, and all the images we'll see throughout the course are in this position, is one in which the body is standing with the face, feet, and palms forward. So the toes of the individual are pointing straight forward, and the palms are also forward. If the individual is laying down, there are two positions that we refer to, supine and prone. So when we dissect our fetal pigs towards the end of the semester, we will look at them in a supine position. So face up would be supine and face down would be prone. A couple of other anatomical directions. If we're referring to something being towards the head of the individual, it would be superior, kind of like you wear a crown. The superior individual wears a crown. Inferior would mean towards the feet. Anterior would be toward the front of the individual, and posterior, I do apologize, there's an R missing there, but posterior means toward the back of the individual. Another word for posterior is dorsal. Another word for anterior is ventral. So if you think of a dorsal fin on a dolphin, that would be the fin on the back of the dolphin. And so your derriere is your posterior, so your back side. Medial means towards the middle of the individual, so towards the midline. Lateral means away from the midline, and the midline would be a line that just divides the individual completely in half, as we're symmetrical from the external appearance. Midline would be that line straight down the center of the body. Lateral means away from the midline. So this you could think about if somebody throws a lateral pass in football, that would be a pass that's immediately to the side. It's not a forward or a backward pass. It is immediately toward the side of the body. So it's directly away from the midline. Proximal means toward or nearest the trunk of the body, and the trunk of the body is considered this area of the abdomen. So you think about this center part of the body, the bulk of the body, and then the legs and the arms would be appendages. So if I said that something is proximal to the trunk of the body, so let's say my hand is going to be distal, which means farthest away from the trunk, then my elbow is proximal to the trunk of the body. So the hand is distal to the elbow. And we'll practice a lot with these terms in class as well. Superficial and deep. As we're doing dissections and such, you will see that there will be some organs that we have obviously layered on top of each other. So superficial organs would be nearer the surface, and deep would be farther away from the surface of the body. So think about a superficial individual is going to be one that usually wears a lot of makeup, and it's all about external appearances. So they are superficial things that are nearer the surface and not deep down in the heart of the individual. Couple of planes or body sections. This will be our last little bit for this video. The frontal plane divides the body into anterior and posterior. So it comes right along the center of the individual, kind of through the head and down the arms, and cuts them in half front to back. A transverse plane divides superior from inferior, so that's like chopping the leg off or cutting the body in half at any other point where it divides the top from the bottom. And a sagittal plane divides into the right and the left halves of the body. If you have a mid-sagittal, if we're making a mid-sagittal incision, that would be we're cutting the individual. That would be right along the midline of the body and dividing it into right and left.